Today we're going to be teaching the application of an Unna Boot. It is a cotton wrap with a zinc oxide paste that promotes healing and keeps the skin moist and reduces skin irritation. It also helps with compression and to reduce the swelling in patients. So it applies much like a hard cast, but this is a soft cast, but you start it over the first and fifth metatarsal head, just as you would a wrap of an ace bandage or another cast. You go over that about 2 or 3 times, and then you start to rock your foot just a little bit. So you go back and forth like so. And the reason we do that is so that if there is a lot of swelling, it allows the patient's foot and leg to swell while still providing compression but not cutting off the circulation. Okay, and then once you get to the heel, you go around the bottom of it without doing the overlapping to get it covered. And then you work your way up the leg just like you would any other wrap, going back and forth, half over each time. So once you get to the top, just as any other cast, you want to make sure your 2 finger lengths beneath the top of the tibia head, and then you'll start wrapping it back down without overlapping, making sure it's not too tight, but still applying compression. And then you want to make sure you keep the patient's foot at 90 degrees. And then smooth the wrinkles out as you go along. Then after you apply the Unna Boot wrap itself, you're going to apply cast padding. And because we're applying cast padding, you want to make sure you do not get the Unna Boot wet, just like you would any other cast. And you're going to apply it in the same fashion as you would the Unna Boot wrap minus the overlapping. So you go around the metatarsal heads, around the foot, and then around the heel. Make sure you're covering each spot of the Unna Boot itself with the cast padding. And we do 1 layer of cast padding. Then after the cast padding, we put on Coban to secure it, keep it on the patient, make sure it doesn't get too loose. So as we apply the Coban, we gotta remember that this is just a cover for the Unna Boot itself, and that you don't want to actually apply any compression with the Coban itself. You wanna make sure you're just covering it up, and otherwise, if you did apply too much pressure with the Coban, it could cut the circulation off or defeat the purpose of the Unna Boot itself. And of course, as you go along, you want to make it look pretty and aesthetic for the patient. So after you apply the Unna Boot, you have to remind the patients of 3 things. 1, don't get it wet, it's just like any other cast. And if they do get it wet, give us a call immediately. 2, if you have any cramping in the back of their leg, in their calf, call the office or go to the ER if we are close, to prevent blood clots, because those are very dangerous. And then usually the doctor is going to put them in some kind of boot or post-op shoe depending on the diagnosis, and want to see them back in a few weeks. And that's the application of an Unna Boot.